Nearly half of all boxers die from cancer. Not old age, not heart disease, cancer. And the difference between catching it early and losing your dog too soon almost always comes down to one thing: what you know. By the end of this video, you'll know exactly what to watch for and when. But the warning sign I'm covering later? Most boxer owners have never heard of it. Here's what makes this so hard. Boxer cancer isn't just common, it's quiet. A mast cell tumor looks like a harmless fatty lump. Lymphoma feels like a swollen gland you'd assume is an infection. And hemangiosarcoma? It grows to the size of a volleyball with zero symptoms until the moment it ruptures. That's when dogs collapse. That's when owners find out. And for many of them, it's already too late. Let's start with why. Boxers don't get cancer at high rates by chance. It's biological. When breeders developed the boxer's distinctive muscular build and flat face, they also concentrated gene variants that impair tumor suppression. The breed has one of the narrowest genetic bottlenecks of any popular dog. That means harmful mutations pass down efficiently through generations with almost no dilution. The result is a breed wired at a cellular level toward cancer vulnerability. If you care about your boxer's health, or any dog's health, subscribing to Griffin's Pack is just what people like you do. There's a second genetic problem that makes boxers especially vulnerable to environmental cancer triggers. It's called GST enzyme deficiency. Glutathione S transferase enzymes are the liver's frontline detox system. They neutralize carcinogens before those compounds can damage DNA. Many boxers have compromised GST function. So when your boxer walks across a pesticide-treated lawn or breathes in cigarette smoke, their body is significantly less equipped to handle it than most other breeds. That's not a theory, that's documented biology. So what does this mean practically? It means lawn chemicals, household cleaning products, and industrial pollutants hit your boxer harder than they hit a genetically diverse dog with the same exposure. This isn't paranoia. This is a breed-specific vulnerability that's well documented. Switching to pet-safe lawn products and keeping your boxer off recently treated grass aren't overcautious choices for this breed. They're genuinely protective ones. The biology backs it up. We'll come back to the action steps at the end. Now let's get into the actual cancers. And we're starting with the one that fools the most owners. Mast cell tumors are the single most common cancer in boxers, and they're called the great imitators in veterinary oncology for a reason. They can look exactly like a soft, fatty lump, a skin tag, a red irritated patch, or a small raised bump. There is no visual profile. They don't look dangerous. That's precisely what makes them so dangerous. Here's the trap most boxer owners fall into. An MCT may actually shrink. You notice a lump, you watch it for a week, and it seems smaller, so you relax. You conclude it resolved on its own. It almost certainly did not. Mast cells contain histamine. When a tumor gets bumped or inflamed, it releases that histamine, which can temporarily change the lump's size by 30 to 50%. That's not resolution. That's the tumor becoming active. It still needs to be evaluated. The rule for boxer owners is non-negotiable. Any new lump gets a vet visit within 1 week. Full stop. A fine needle aspirate is minimally invasive, it's inexpensive, and it can be done in a single appointment. A low-grade MCT caught early often cures with surgery alone. A high-grade MCT can metastasize to lymph nodes, the spleen, and the liver within weeks. You cannot tell the grade by looking at the lump. Only cytology tells you that. The second most common boxer cancer is lymphoma, and it has a cruel pattern. It often looks like almost nothing in its early stages. The most common form is multicentric lymphoma, where multiple lymph nodes throughout the body enlarge at the same time. Owners usually first notice swelling under the jaw, behind the knees, or in the armpits. The nodes feel firm and rubbery. They're typically not painful, and that's exactly why so many owners dismiss them as a minor infection. Other early signs of lymphoma include reduced appetite, gradual weight loss, increased thirst, and a dog that just seems off without any specific complaint. Sound familiar? A lot of boxer owners describe this vague, something isn't right feeling before a diagnosis. Trust that instinct. With lymphoma, the GST enzyme deficiency we talked about earlier is part of the story. Chronic low-level DNA damage in lymphocytes accumulates over time, eventually triggering malignant transformation. Environmental exposures genuinely matter more for this breed. The good news on lymphoma is this: chemotherapy using the CHOP protocol can achieve remission in 60 to 90% of cases, but remission duration varies widely. Early detection dramatically improves both how well a dog responds and how long the remission lasts. Before the cancer invades bone marrow or other organs, the window is still open. After it does, it narrows fast. Monthly lymph node checks at home aren't optional for boxer owners. They're part of the job. Have you ever done a lymph node check on your boxer at home? Drop your answer in the comments. I read every single one, and your experience might help someone else watching right now. Now we get into the territory that genuinely shocked me when I went deep on this: brain tumors. Boxers have one of the highest documented rates of primary brain tumors of any dog breed, specifically gliomas. Boxer brain tumor tissue has actually been used in academic research to model human glioblastoma because the molecular signatures are so similar. NC State University's Veterinary College has used boxer patients to inform human brain cancer treatment trials. Let that sink in. The age window is specific and important. Boxer brain tumors typically develop after age 8. That makes this a senior dog concern, but one owners need to start anticipating from middle age. The warning signs are neurological and behavioral, and they get misattributed to normal aging constantly. Seizures are the most common presenting sign. And here's the rule every boxer owner needs to memorize. A first seizure in a boxer over age 8 with no prior seizure history should be treated as a brain tumor until proven otherwise. Other brain tumor signs to know: sudden personality changes like aggression or fearfulness in a previously even-tempered dog. Walking in circles. Head pressing, where a dog pushes its forehead against a wall or floor. Loss of house training. Confusion. Stumbling. These get written off as just getting old all the time. Don't. Any new neurological symptom in a senior boxer deserves urgent veterinary evaluation, ideally with a neurologist referral. A regular exam will not catch this. An MRI will. Now for the hardest one. This is the cancer I mentioned at the start, the one that kills without warning. Hemangiosarcoma is a cancer of the cells lining blood vessels. It can grow anywhere in the body where blood vessels exist. In boxers, it most often hits the spleen, the heart, and the skin. The internal forms are the truly dangerous ones because they produce almost no symptoms until a tumor ruptures. And when that happens, the dog hemorrhages internally. This is how it happens. A splenic hemangiosarcoma tumor can grow to the size of a volleyball before the dog shows any outward sign of illness. Then it bleeds. And a dog that was playing fetch in the morning can collapse by afternoon. Owners have lost boxers this way. The dog seemed completely healthy. And that's not a horror story. That's the documented biological reality of a cancer that hides inside blood vessels until there's nothing left to hide. But there is a warning pattern. It's called transient collapse. A dog briefly collapses or seems extremely weak, then appears completely fine within minutes. Most owners dismiss it as a one-off, maybe overheating, maybe tripped. It's not. That pattern represents a small bleed that temporarily resolved. The tumor is still there. It's still growing, and the next bleed may not resolve. A transient collapse in your boxer is an emergency call, even if your dog seems totally recovered. There's a check every boxer owner needs to do weekly, and most have never been told about it. Check your dog's gum color. Pull back the lip and look. Healthy gums should be bubblegum pink. Pale gums, white gums, or gums with a bluish tint are a medical emergency. They indicate the dog isn't circulating blood properly, which in a boxer context means internal bleeding until proven otherwise. This takes 5 seconds. It could be the 5 seconds that saves your dog's life. For skin hemangiosarcoma, the picture is more hopeful. Boxers with light or white patches of skin are at higher risk for UV-induced skin HSA on sun-exposed areas. It appears as a dark red-black lump on or under the skin. Unlike internal HSA, it's visible. It's more treatable when caught early. Check your boxer's light pigmented areas regularly, especially on the belly and around the ears. Limit unprotected sun exposure on those patches. For this form, awareness genuinely changes outcomes. There's a fifth cancer that deserves attention, and it's one most boxer owners have never heard of. Insulinoma is a tumor of the pancreas that causes the body to produce too much insulin. A January 2025 UK study of over 2 million veterinary records specifically flagged boxers as a breed with statistically elevated insulinoma risk. Signs include episodes of weakness, wobbliness, sudden collapse, and seizure-like events, especially after exercise or when the dog hasn't eaten recently. Those signs are often missed until the disease is advanced. Okay, now we get into what you can actually do about all of this. And this is where the video shifts from what can happen to what you can change. Every boxer owner needs an age-stage detection plan. Not just take your dog to the vet, a specific roadmap based on your dog's current life stage. Because different cancers emerge at different ages, and screening priorities need to shift accordingly. Let's go through it stage by stage. Ages 1 through 3. This is your baseline window. Your goal right now is to learn what normal looks and feels like on your specific dog. Establish the texture and size of every lump and lymph node while they're healthy. Start monthly lump checks as a habit now, not as a reaction to fear later. Talk to your vet about your dog's genetic risk profile and get baseline blood work on record. You're building the comparison point that makes future changes detectable. Ages 4 through 7. This is your highest MCT and lymphoma risk window, and monthly lump checks are now non-negotiable. Any new lump gets a vet visit within 1 week, no exceptions. Annual wellness exams should now include lymph node palpation that's documented in the record. Ask for it explicitly if your vet doesn't do it. Consider twice-yearly blood work and urinalysis, and start talking to your vet about whether abdominal ultrasound screening makes sense for your dog. Age 7 and beyond. This is when you add hemangiosarcoma and brain tumor vigilance to everything you're already doing. Annual abdominal ultrasound becomes part of your boxer's wellness routine, not optional. Learn to check gum color weekly. Watch for first-time seizures. Watch for that transient collapse pattern. Vet visits shift to every 6 months minimum. And ask your vet about liquid biopsy testing, which can detect cancer-associated DNA fragments in a blood sample. That technology is entering veterinary practice right now. The universal rules apply at every age. Any change in behavior, any new lump, any unexplained weight loss, any pale gums, any first seizure. Those are same-day or next-day vet calls, not let's wait until Monday situations. Boxer owners cannot afford a wait-and-see approach with these cancers. The window between caught it and we're too late is often weeks, not months. You don't need to be afraid. You need to be fast. If this video made you feel more prepared for what your boxer might face, Subscribing to Griffin's Pack is how you stay that way. We publish the dog health content most owners never get told until it's too late. Here's your action step for today. Right now, after this video ends, do a 5-minute lump and lymph node check on your boxer. Neck, armpits, behind the knees, groin. Feel what's there. Take a photo if you find anything. Call your vet if anything is new or has changed. And book that abdominal ultrasound conversation if your boxer is over 7. You have everything you need to start protecting your dog today. One question for you in the comments. How old is your boxer? And have you ever had a lump checked out or a lymph node scare? I want to know. And other boxer owners watching this need to hear your experience. Subscribe to Griffin's Pack because your boxer deserves an owner who keeps learning.